Hello, welcome to the Grand Round.
Hi, my name is Melissa Wilson. I'm joined by my colleague Dave Whitehead. We've come from Mersey Care Community IV Therapy Team just to tell you a little bit about our service today.
Great.
So community IV therapy services can be of significant benefit to both patients and the NHS. They can prevent hospital admissions and facilitate early discharge, improve patient safety by reducing the risk of infection, and improve choice by enabling patients to stay in their own homes. The aim of this session is to provide awareness of our team and the services that we provide, to strengthen the relationship and improve communication between in-hospital referring staff and the community team. Facilitating early discharge requires a multidisciplinary approach, and good communication between hospital and community staff is essential. We are a nurse-led specialist integrated community nursing team made up of experienced nurses from various backgrounds, supported by a HCA and administrator.
So I'm one of the coordinators. We basically administer the IV therapy caseload over the whole of Liverpool and Sefton. At the moment, we cover blood monitoring in blood transfusions in the Liverpool area, and it's just IV antibiotics in North Sefton at the moment, although there are ongoing discussions with the CCGs about getting an equitable offer of all services for all the areas that we cover. We provide troubleshooting for district nurses who may be looking after lines or doing straightforward IVs, education and support for those community nurses, and look after portacats and all related things. The IV antibiotics that we take from the hospitals, they generally go through the OPAT teams. We take referrals from every hospital. I mean, it doesn't necessarily have to be in the area. As long as the patient or the GP are in our catchment area, then they'll be one of our patients. There are OPAT teams in Southport and Fazakerley and the Royal who've just merged. So we have virtual ward rounds with them weekly. That's how we manage the caseloads and patient flow. The blood and blood products, as I say, at the moment, that's just Liverpool, although we have been working on trying to get that for Sefton for a while. The PGD, Patient Group Directive Cellulitis pathway, that covers all the body in Liverpool, lower limb in South Sefton, and at the moment there isn't anything for North Sefton, but again, I think there's a meeting later on. Our team leader's got one of those. Trying to get that rolled out. We did pilot a scheme a while ago, and we're looking to start that up again in North Sefton. We look after things like portacats, Hickman lines, and any vascular device really.
So that's just showing you our caseload area. So we split into 4 areas at the moment, but we cover it as one team. So we've got Central Liverpool, North Liverpool, South Liverpool and Sefton, including Southport and Formby. So our team objectives are admission avoidance. We facilitate early discharge, getting patients out of hospital as quickly as we can. Aim to deliver high quality evidence-based care, we keep up to date, we have regular training. We're aiming to deliver perfect care. That's part of an initiative at the moment by Mersey Care that we're striving for. We're providing a supportive environment for our team members, making sure we've got regular access to clinical supervision, things like that, and to provide specialist advice and support to other teams. So that includes the district nursing teams and other community teams within our area. So our patient outcomes are we've 0 line infections, which were achieved. We've never had a line infection. Patient completes the treatment within the expected time frame. We obviously work with OPAT and microbiologists, make sure that if patients need to be extended, then that's done timely, regular blood monitoring, things like that. Cellulitis response time. So if we receive a referral, we have a deadline to see the patient the same day. If not, they'll be seen the next day. And no delayed discharges. So obviously making sure everything's in place for the patient so that they can come out of hospital amid streamlining referrals, speaking to referring staff, making sure that everything's in place with medication.
Okay, we get referrals from lots of different places. Hospitals, obviously, that's Southport, Firackley, Walton Centre, the Royal, Broad Green, Wiston and Wrightington. We've had referrals from hospitals all over the country, to be honest, for patients who live in our area. We take referrals from GPs. We will go out and cannulate the patients and start the treatment there. Well, we can on occasion take it from their specialists, not necessarily in the community, but certainly from the hospital. We don't take them from walk-in centres, I think, but generally the patient, they tend to either stay at home or go to the hospital and get referred to us anyway. They've got to fit the criteria, so either the patient or the GP must be in Liverpool or Sefton. They have to be medically fit for discharge. They need a discharge address, also a home phone number if possible, and that environment needs to be suitable. If they're able to attend clinic, that's also fine. We've got a few clinics spread throughout the area, although we're still trying to get one in North Sefton. At the minute though, we've got one in Garston in South Liverpool, Breeze Hill in North Liverpool and Litherland Town Hall in South Sefton.
So this is just our referral process. So we're identifying a patient in hospital who meets our referral criteria. The referral can be sent across. Patient must also be referred to microbiology, so they've got that in place before that referral reaches us. So the referral is sent via SPC, that single point of contact through Mersey Care. The email address is at the top there. There is also a phone number which can forward over to teaching that can be disseminated out. The referral, once it reaches the IV teams, screened by the IV coordinators, make sure that it fits our criteria, and then the coordinator will liaise with the referring practitioner to facilitate the start of treatment. We'll get the patient out as soon as we can, and only once all that's in place can the patient be discharged. So this is our formulary. Most antibiotics we give once a day. We can give them twice a day if we've got capacity within the team. Most commonly used IV antibiotics are ticaplanin, daptomycin, ceftriaxone, ertapenem, and more rarely we'll give ceftazidime, meropenem, tigecycline. We are shortly going to be rolling out an elastomeric pump, which is once daily antibiotic, which is administered over a pump, and that can be that can be done once a day, the patient's home, and we use tazocin for that, so that will be really good. The patient can stay on optimum treatment. We won't have to change antibiotics to be discharged from hospital.
The main things that we tend to treat is cellulitis, diabetic foot, ulcers and joint infections. Osteomyelitis is a very common one. UTIs occasionally, liver abscesses occasionally. Discitis, I mean, we'll give them for anything. These are just the most common ones that we'll see. Bronchiectasis is a big one for us. A lot of the patients we've got on with orthocathrin are long-term bronchiectasis patients, and they tend to come on and off our caseload. Everything you can see there.
So we'll do daily, once a day, or BD visits, morning and afternoon. We'll also do weekly dressing change and access device monitoring to make sure that our VIP score and infection control policies are adhered to. We do weekly bloods monitoring and liaise with the OPAT teams and do a virtual ward round to discuss patients who need blood monitoring levels, make sure that the treatment's achieving the outcome that we want it to. Just fitting in with that, we make sure we've got constant communication with the acute trust consultants and microbiology. If there's a problem, we address that quickly. and then we deliver treatment either through home visits for our housebound patients or in clinic settings for patients that are able to attend.
The PGD for cellulitis is, as I said, at the moment, this is mainly Liverpool for any part of the body and lower limb for South Sefton. Well, that says it's not currently offered in Southport, and it isn't. That hopefully will change very soon. The pathway, if it does change, is 2 gram ceftriaxone for 3 days, followed by 7 days oral fluoxetine, 1 gram QDS. If they're allergic to penicillin, we give 3 days ticaplanin, then 7 days oral clindamycin. We then would go back at the end and see how it's getting on and take it from there. If they're cured, brilliant. Sometimes they need more orals, sometimes they need more IVs. We do have the facility to extend the IV treatment before they go on to orals if necessary.
So the blood transfusion caseload isn't currently offered in Sefton. This is a Liverpool service. We work with Clatterbridge Cancer Centre, Royal Liverpool University Hospital and Broad Green Laboratories to offer a community transfusion service. The majority of these patients are nearing end of life, so the home transfusions are a nicer alternative to attend in the hospital setting. We can also offer the transfusion service at South Liverpool Treatment Centre as well in the patient's own homes, but that's less common. So our nurses will visit the day before and obtain the blood samples, full blood count and group and save. And then if the blood transfusion is indicated, we'll visit the next day and do that in the patient's own home. We do also work with the GPs to offer blood transfusions as and when they're required. The criteria for that is that the patients must have had at least 1 hospital blood transfusion with no reaction for us to be able to offer that service.
As I say, that's very much a planned service. I mean, we are a planned service, not an emergency service. Portacat care and chemotherapy disconnects. That's something that we do mainly for Clatterbridge, London McCartney Centre. We've got a lot of patients with Portacats. We access them as need be every month just to maintain the line. We can do chemotherapy disconnects, as you see. We do Christie's, Clatterbridge, all of the local hospitals that provide chemotherapy. They will go into the hospital and generally, although there are several regimes, obviously, generally 48 hours later, we'll go and take the pump off. We've got a few from Wrightington, I think, sometimes. But we train the DNs to do it from PICC lines and hopefully soon to take off from Portacats, but that's a work in progress.
So just going on from our team initiatives, we want admission avoidance. So for every hospital bed per day saved is between £350 and £500. We've got over 1,250 patients in the service since 2014 and 62 patients on the caseload currently, and around 30 regular Portacat patients. So that's approximately £1.5 million a year saved by admission avoidance from our team alone. So for the future of the IV team, so we've recently started working 8 to 8 shifts. This is allowing us to get more patients through the service, picking up more BD patients in particular, better response times for the patients if any problems arise. We have, as Mersey have recently taken over Southport community setting, so we'll be offering the district nurse training across Southport very shortly, so that enables us again to get more IV patients out into the community because they don't currently offer that service.
Yeah, with the heart failure service aspect is something that we've been looking at for a while. That will be IV furosemide. That's not up and running at the moment, and the lead is very much being taken by the heart failure service, the heart failure specialist nurses rather, and we're involved with that for the venous access with them. I don't know what line service is.
Oh, midlines.
Oh yeah, midlines. The midlines, we some of us have been able to put midlines in previously, and we're just looking to get the whole team trained up to be able to insert midlines in the community for mainly GP patients or patients who've perhaps had a line in, something's gone awry with it, and we need to put a new one in.
Okay. So our contact details are there. I'll leave that all. As I say, work 8:30 till 8, 7 days a week. We are an answer phone as well, so if you ever need to contact us, can leave a message on there. The Sefton caseload holders are myself and Jane Mulrooney, so if you've ever got any queries, you can always ask for one of us, or alternatively, the IV coordinators are available. Just the link on the bottom there is for our referral paperwork. It's all on our homepage on Mersey Care's website. And I think that's it from us.
Thank you. We'll end the session now.